The recovery for shoulder surgery can vary depending on the type of procedure that is performed. A rotator cuff repair, for instance, will frequently require a period of immobilization, somewhere from 4 to 6 weeks, depending on a surgeon's preference. And then from there, we'll progress into a rehabilitation course that can stretch up to about 6 months out from surgery in order to maximize range of motion and strength. Contrast that to a shoulder replacement, where immediately after surgery, within 24 hours, we're trying to initiate motion very quickly. So patients are beginning to move the joint, beginning to do very light day-to-day things, especially down around waist level for activities such as using a computer, setting a table with silverware. You can see there's a stark difference between the two just with two simple conditions that we commonly see.